take a moment and delve into the science and the data. And in particular, the data. Are we getting enough when it comes to the situation with COVID-19? I'm Greg Bishop. I chatted with Ted Dabrowski from Wirepoints last week on a variety of different things, data that I was able to get from the Illinois Department of Public Health about the mortality rate for certain age group from 18 to 49. We'll touch on that. But Ted also has been independently gathering data and analyzing it from a variety of different ways. And we talked a bit about some of the things that Wirepoints has done recently in the data they've analyzed, including data on what's considered breakthrough cases. And those are cases of individuals who got vaccinated, but either got sick or hospitalized or died. And Ted and his team with Wirepoints analyzing all this data from the past 2 years and really looking at this breakthrough data that we've gotten just from the past year now that vaccines have been available. And he talks about some of the statistics that they've been able to glean from all of this data.
Well, we're finding that breakthrough deaths continue to grow. Of course, all deaths have grown, all COVID deaths have grown, but breakthrough deaths have started to increase, um, not just in total number, but also in the percentage of deaths. So most recently, we've seen breakthrough deaths almost reach 40% of total COVID deaths in the last week, anywhere between 30 and 38%. So or 30 and 40%. So obviously, this Omicron is having an effect not just on the unvaccinated, but the vaccinated. And what we're trying to do is figure out exactly what that impact is. Most recently, Governor Pritzker, in early January, he said that only 5% of the people in the COVID ICUs were vaccinated, meaning that everybody else is unvaccinated. Yet here we are having almost 40% of our deaths be of the vaccinated. So it's really confusing, and we're trying to square that up, but we don't have answers to that right now.
Well, and I asked him also one of the things that I've received from internal documents of a hospital group indicated upwards to 40+% of those in the hospital are those who have been vaccinated. Now, we don't know if that's those who are in the hospital because of COVID or in the hospital with COVID, somebody who maybe is undergoing some kind of surgery that's not COVID related. But still testing positive for COVID. But some of the numbers that I've seen, 40+% are now vaccinated individuals in hospitals. And Dabrowski says that he's seen similar types of data.
Yeah, I'm seeing some of that hospital data as well. Of course, we don't have, this is one of the problems we have in Illinois is the public isn't giving this data, but I've gotten some information through people I know of, again, hospitals at about 50% of the vaccinated. And I think the big news there is that anything we thought about the vaccine stopping the spread of COVID to the vaccinated is gone, and we also know that the vaccinated are now spreading COVID. So that matters a lot because in Cook County and in Chicago we have these vaccine passports that are basically mandating that people show that they're vaccinated so that they can attend a restaurant or a bar or a sports facility. Well, that no longer makes sense. It's no longer obsolete, that requirement, because everybody spreads right now.
We're hearing from Ted Dabrowski, conversation I had with him on Friday afternoon about COVID-19 data and some of the latest numbers that he's seen. And we'll talk about the age range of 18 to 49 when it comes to excess deaths that the Illinois Department of Public Health shared data with me on. But when talking about vaccines and breakthroughs, really it's just about vaccine awareness. More from Dabrowski.
But yeah, it's definitely not. Obviously, we know that the unvaccinated are dying more. They're more at risk, and we know that the vaccine has some effectiveness against serious illness and death. That's I think everybody still agrees to that. However, you can no longer say it's a pandemic of the unvaccinated. This Omicron's hitting everybody hard. If half the hospitals are full of vaccinated people, if in Vermont and in Massachusetts, more than half of the deaths in the recent weeks have been of the vaccinated. So this Omicron is showing that it's everybody. That there's really no way to avoid it right now, at least this variant. And so, it's why we're seeing, I think, a lot of places. We just saw Denmark unwind their COVID protocols. The UK unwinding their protocols. Some people are treating this now where we're kind of just got to get back to normal as much as we can because it's everywhere.
Now, I take a moment here to share with you some of the data I got from the Illinois Department of Public Health based off of reporting I'd seen elsewhere across the country, reviewing the excess deaths of individuals in a certain age range. So I asked early last week for the Illinois Department of Public Health to provide whatever data they had for those who were 18 to 49 and their mortalities. Is it something that is feeding into the excess deaths that we've seen in the past 2 years? So the numbers they provided, a spreadsheet, shows that in 2020, there were around 24% more fatalities of those 18 to 49. And in 2021, there were 29% more fatalities of those 18 to 49 than compared to the average from 2017, 2018, and 2019. So you're seeing about a 27% increase over those 2 years of 2020, 2021. Compared to the average for 3 years prior. COVID-19, is that something that plays into this? Sure, but to the scope that you've seen that much of an increase, the numbers don't show that. The total number of excess deaths for 2020 and 2021 in that age range combines 4,467. But the number of deaths for that age range that are COVID related was only 1,700. So you're looking at around 2,767 deaths that were considered excess deaths in 2020 and 2021 of the age range 18 to 49. These are working age people, and there's thousands more excess deaths that aren't attributed to COVID-19. Dabrowski reacting to some of that data.
Well, those numbers are fascinating, and if they're correct, and if they're, if 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 deaths are 30% higher for that age group and 24% higher in 2020 compared to previous years, that tells us it's a lot more than COVID. We've had less than what is it, 1,600 deaths in COVID over 2 years, so about 800 a year on average. That wouldn't explain the numbers you just told me. So that would imply that there's a lot of deaths of the despair, as they're calling them, opioid deaths, violence, etc., as a result of COVID, because that's a very large increase if those numbers are what we think they are. That's a massive increase, 25% increase in deaths. It's not COVID. It's going to be much more than COVID.
So some of the numbers that I was able to get on this particular age range, 18 to 44 in particular, it's how the IDPH has parsed out some of the data in their mortality statistics that they have. And they don't have all of the data for 2021, with the exception of 3/4 worth of opioid deaths. But for 2020, for the age range 18 to 44, the leading causes of death were accidents, assaults, suicides, and heart disease. COVID-19 is not even registered as a cause of death for those 18 to 24, and COVID-19 does show up as the number 6 reason for those dying 25 to 44 years old, or about 370 out of 6,439 deaths in that age range of 25 to 44. So you can see, again, highlighting some of what Ted had to say there about these numbers, is it's a lot more than COVID that's killing the 18 to 49-year-olds. And it seems to be more kind of deaths of despair, violence, overdose, suicide, those types of things. And he says that the public needs to know this data. They need to better have a grasp of just how this is all impacting them on a daily basis.
Well, they need to know that there's no transparency. We get very little data on what's actually happening, and I think with so much distrust built over time by the federal government and at the local level, people are hungry for the data, but they know they don't get it, and it makes it really hard for people to make their own decisions. And we know with something like a vaccine, it should be done under the principle of informed consent. People should know exactly what they're getting, why they're getting it, what the data is. And in Illinois, Governor Pritzker is not helping us. IDPH is not helping us. They give us partial data. It's confusing. Nobody really knows what's going on, and the government can say whatever they want, and they want people to believe it. But we've seen too many cases of the data just either not being true, or being confusing, or contradictory. And so we'd love to see much more data. That's our big appeal to Governor Pritzker and IDPH.
And I gave Ted a moment to provide a bit of a final word here when looking at all of this data, and in particular, the vaccine breakthrough data and the data I shared with him from the Illinois Department of Public Health about the mortality of those 18 to 49 years old.
Just the one important fact is that Illinois, we live under very strict mandates, but what most people forget is that we're only one of 11 states that mandate, this mask mandate, for example, one of 11 states, and nobody in the Midwest except for us does it. This is an East Coast thing and a West Coast thing, and Illinois. So, while other states are living more freely, we continue to be under very severe and strict rules.
So again, that's some of what I had to talk about with Ted Dabrowski from Wirepoints on Friday, sharing that with you on the WMAY morning news feed. I'm Greg Bishop. Thank you so much for tuning in as always, and we'll have plenty of opportunity to talk about that and